for people who maybe don't know quite so much about Knowledge for Healthcare, how would you describe it to them? How would you tell people what it's all about?
Fundamentally, it's a change program, but at a really fundamental level. So it's about taking services which were highly respected as a powerhouse of education and learning and research, and indeed around evidence-based practice, although perhaps through a slightly academic lens on that rather than a practitioner lens. Our services have always been highly respected, and health librarians, health library teams are highly trusted, and that's through the decades of work and the commitment of people who come into work as information professionals in the NHS. What we were seeing was the need to take that forward into establishing knowledge services as the basis of is, as a business critical basis of what is, after all, a knowledge industry.
Yeah.
So, to make sure that decisions that are made across the service day in, day out, whether by an individual patient or an individual member of staff or somebody buying resources, making investments of all kinds, that they should be based on the best kind of evidence, and that's a 360 degree of evidence. So you've got the evidence from research, of course, you've got what data about activity and population tells us, but you also have this wealth of patient experience of the use of health services and a wealth of knowledge of staff, which is best described as know-how. And we could have a theoretical discussion about knowledge translation and knowledge transfer and all those things, but really it's what's in the heads of people who have worked in the service and who use it, run it day by day. So that breadth of knowledge is where we're coming from. So that's a real mix of library skills, knowledge management skills, knowledge translation and mobilization skills, and that's where we wanted to take the strategy forward through Knowledge for Healthcare.
It's been fantastic to watch, and as you know, from our point of view, that shift in the nature of the workforce and its role is something we've learned a lot from working with you in health, and we're seeing emerging everywhere now in library and knowledge services in other sectors. I mean, I guess if I'm an employer working in the healthcare system and I'm not too familiar with the work of libraries or knowledge services, what are the things I really need to know? What message would you really like to get across to them?
Okay, well, I'm going to give you a couple of quotations. So
okay.
We have a relatively new chief executive, Dr. Navina Evans, coming from being a foundation trust chief exec, and her phrase is that applying knowledge into action is the currency of a successful healthcare organisation.
Beautiful.
So there's a fair degree of food for thought there for any chief executive or executive team in the health service. And to give another quote, which it's a magnificent piece. I don't actually know the individual who wrote it, but it comes from the National Institute of Healthcare Research. Evidence does not speak for itself. Evidence does not speak for itself, but it needs to be mobilised at the right time and through the right people to make a difference in decision making. So knowledge services are an essential part of the decision making infrastructure of the NHS, as well as its education and training infrastructure. And I guess those are the key things I would really want people to know and employers to know. To add to that, there is at the sharp end, at the pointy end, there is a duty within the Health and Social Care Act 2012 to use evidence from research across the service. That makes every sense. And as we're here in our digital age, there is a tremendous need to accelerate the spread and adoption of services and the spread and adoption of innovation.
Yeah.
We also know that knowledge and library services and how good they are is a factor for NHS organisations in terms of recruitment and retention of staff. So all those things together are really significant reasons why people should take up and set up and listen, and that's without, of course, the issue about the difference that our services make day in, day out.
So just in case we've got employers listening in today, where do they go? What do they do next? Where would you send them off?
Where do they go next? So they go, first of all, they go and find their library service. And I've spoken to people, I've spoken to Chief Finance Officer, for example, who said, well, until we did this project with you, I hadn't really thought about them very much as people who can inform our practice, because, it's really easy to think of them as people who inform clinical practice or learning, clinical learners, as new professionals come through. So first thing is to go and find your service. And if you want to have discussions about how that service might change or how it might work over a larger geography with other services, do come and, well, always find me, of course. We'll make sure that my email address is at the end. But we have development leads within my team, within the Health Education England team, working right across the 7 regions of the NHS in the country, and are delighted to advise. But your people on the ground will have really good relationships with some teams and be making a really powerful impact with some teams. But it will be fragmented. NHS organisations trust are large organisations, and there's much more to do.
Yeah, no, it's a big beast, but absolutely go and find your service, talk to them, and I'm glad to hear people can make contact with you as well. I mean, I guess we know as well from engaging with some heads of trust in the past that there's this real focus on the patient, that ultimately we've always got to be clear about patient-centered care. So if you were asked to articulate, how does all of this knowledge mobilisation benefit the patient, what would you say?
I'd tell them a story.
Okay.
You will recall that you and I, discussing this issue of advocacy of knowledge and library services and how do you tell the story in ways that are powerful and compelling, spent time coming up with an idea. And we came up with the idea of a campaign called Cash a Million Decisions, which has served us with 2 purposes. One is that it's given a platform for health, knowledge and library specialists to articulate the stories of the difference they make and the kinds of differences they make to healthcare. And it's also allowed us alongside that to recruit a whole series of wonderful champions who will tell the story for us as well. But right here now, I've got some examples up of some of those stories, and I thought I'd just zip through these to show you the kinds of difference that library knowledge services make. And these are all very real examples, and they're all ones that come from the latest Strategy of Knowledge for Healthcare, published this year, 2021 to 2026. So this is a single example of how some work done by one of our library teams, this one in Doncaster and Bassett Law, impacts on staff time, on patient safety, and reduce costs. If you can get the right information to inform a clinical use of a clinical therapy, use of techniques, use of a diagnostic in this case, this is all about reducing unnecessary abdominal x-rays. Yeah. And the impact of the evidence that was brought to bear here and then fed into the quality improvement project and team working at the hospital has, as I say, increased patient safety and reduced cost to an estimated saving of 30,000 a year. So that's the first example, and patient safety really there, top of my tree.
Fantastic.
And then if you look at taking that forward, there's so much work to be done around clinical practice. Now, again, if you're an exec on a board, you're now going to be working through integrated care systems. You will be working with a whole series of boards. Your teams will be working across a geography, and they'll be looking at population. They'll be looking at priorities around a place with a real place-based focus on wanting to harmonise approaches, protocols around the best possible evidence that we have. And so this is a great example of a clinical change management group which takes forward a whole series of decisions. And here you have the library team bringing in objective evidence to provide that reliable evidence base for multidisciplinary teams of clinicians to lead taking changes forward. And I know that this consultant surgeon obviously recognises the time that is saved, but really this objective viewpoint to bring things together on a strong evidence base. So really driving your changes across the system. The workforce, staffing, recruitment, retention, giving people satisfying jobs with which they want to stay through a career or as a basis for extending their career is a key issue for employers. It's absolutely imperative that they get the team right to deliver patient care, but they also get the roles right for the individuals and for the disciplines and professionals so that they can have a really thriving employment base within their community. So this is an example of where evidence being brought to bear can assist a service review to look at the shape of the service in terms of the workforce and support workforce redesign. And again, really, really important that that is brought to bear on a regular basis. Day in, day out, individually, people like you and I are engaged in a discussion with healthcare professionals. We may have choices to make. We may need to understand the risks of one choice versus another. And this is an example around how the knowledge specialist was able to upskill the specialist, the clinical specialist, in this case around using clinical evidence apps, which he has applied both to inform his own clinical practice, but to use that same app to share content to explain the risk to patients. So an unbelievably important step for any one of us in our experience as a patient, as well as a learning tool across the whole piece. Keeping up to date, you can imagine, I mean, I could have produced you lots of cartoons of, you know, the sheer weight of content that is coming in, rapid advances in our field all the time, extraordinarily so. So keeping up to date is a major challenge for our clinicians and everyone working in the health service, everyone, whether you're whether you're an estates manager or in the finance team, keeping up to date is a big issue with different aspects of your professional work. So again, this key role around helping people have targeted, tailored information that can help them keep up to date is extraordinarily valued right across the health service and a key part of the work of knowledge services. And finally, I've chosen one other example here because health literacy is just such a key issue. You know, the figures for the ability of adults to really make sense and understand and use health information are quite shocking. And we are working hard, our health and information specialists through libraries in the NHS are working hard to work alongside information providers in other respected places. Public library services, great example, to make sure that the information services are able to share high quality information, but have the skills to communicate around that. So those are some of the ways, some of the differences that that knowledge services make day in, day out. And you've seen their cost. So you see there examples of patient safety, cost, staffing, policy change, clinical protocols change, and working with the public. So an extraordinary range of ways in which these services make a difference. And that is without the absolute fundamentals of education and learning for the current workforce and for the future workforce. And that requires remembering that 10%, 50% of today's workforce will still be in post in the NHS in 10 years' time. Yeah. So you can't just say the job's done. Keeping up to date, continuing to learn, especially as digital technologies advance, is really key.